Let's talk about cardiac risk factors, or the reasons people develop heart attack and stroke. We call them cardiovascular risk factors. The most common cardiovascular risk factor is having high blood pressure. High blood pressure is one of the common conditions in America. 1 in 4 Americans have high blood pressure. And after age 50, 1 in 3 Americans have high blood pressure. And after age 70, half of the Americans have high blood pressure. So it's a very, very common condition. High blood pressure is defined as any blood pressure number above 130, the top number, the systolic blood pressure, or the bottom number, the diastolic blood pressure, above 85. People below age 50, typically the bottom number is important, the diastolic blood pressure. And for people above age 50, it's the top number, systolic blood pressure, which is very important. So high blood pressure, when it's not controlled properly, can lead to plaque buildup. So again, one of the common risk factor is high blood pressure. Blood pressure control lately has been somewhat easy because of multiple different types of medications being available. So if you have a high blood pressure, make sure you talk to your physician to get the blood pressure below 130 over 85. Many times you will require 2 or 3 medications to control your blood pressure. If you have diabetes, if you have kidney problems, sometimes your blood pressure may need to be lowered below 120. Again, the top number, systolic blood pressure. If your blood pressure is difficult to come under control, despite of using multiple medication, make sure you ask your doctor to have further workup, including seeing a specialist for high blood pressure, which includes cardiologist and kidney specialist. If you are on the blood pressure medications, make sure you take them regularly. Typically, blood pressure medication should be taken at night because the highest blood pressure reading typically seen at 2 in the morning, between 2 and 5 in the morning. So again, make sure you control your blood pressure at night time. Many patients take their blood pressure medicine in the morning, and at night time, when the medicine is wearing off, they are exposed to the highest risk of developing stroke and heart attack. So again, check with your physician what's the best time to take the blood pressure medicine. Purchase a blood pressure machine at home so you can monitor blood pressure at home. Reach out to your doctor if blood pressure starts going high. Keep the salt intake very low. Keep the salt intake very low. Exercise regularly, just 20 minutes a day of walking. Do some form of meditation or praying. Attend regularly family and religious activities. All those additional lifestyle change will help the medications to control your blood pressure. Blood pressure is the most common reason people will develop heart attack and stroke. So please control your blood pressure. This is Dr. Aajay Shah. We're talking about heart attack and stroke prevention tips and techniques.